Seniors use 3 to 4 times more prescriptions than the general population. Managing their use of these prescriptions and providing valuable in-home counseling to seniors is what Senior Pharmacy Solutions provides to seniors in the Louisville area. Lynn Harrelson is my guest on the Aging with Options show. Thank you for tuning into our show. We've been discussing the very innovative and useful program that Lynn's company, Senior Pharmacy Solutions, offers, medication therapy management services. Lynn, in the last segment, you told us a little bit about the process that you go through with each of your patients and how that process works. Tell me, is your goal, are you trying to reduce the medications for seniors, or you just try to help them mostly manage the medications that they're taking, or a little bit of both?
It is a little bit of both. I want to make sure that the medicines they are using are used in the best way to get the best results.
Right.
But I also want to make sure that if the patient no longer needs a medication or is no longer benefiting by a medicine or it's causing problems, that we get that information to the prescriber, if it's a prescription medication, and we handle it then and present information to the physician about the findings, what's going on with the patient. And a lot of the physicians really like that because it's very, very detailed in the information that I'm able to provide them. And then the items that are not prescribed, then we talk about things that maybe they would want to do otherwise, or how they would handle the medicine they're going to self-medicate with, and what the pros and cons are. But it's to make the most of whatever medicines they're using.
Right. Now, we know that there's a number of different motivations for wanting to reduce the number of medications. Mm-hmm. You told us earlier that on average, an average senior is taking 8 medications. Mm-hmm. But we know that there are many advantages. One of those, we know that the number of medications that you're taking, the more you're taking, the odds increase as to the number of side effects, the number of negative consequences of taking more medications, right? That
collective term, that medication-related problems, it can be the side effects, or one of the problems that we have are just losing our independence, going to the emergency room, eventually the hospital, or ultimately into the nursing home, can be caused by the medications that we used. If you are a senior and you're taking 2 medications, there's a 6% chance of having a medication-related problem. If you're taking 5, it's a 50% chance. Remember I said that the average is for seniors is 8 medications. If you're taking 8 medications, there's a 100% chance that you will be having a problem with your medications.
100% chance.
100% chance. Now, what that may mean is it may make you feel drowsy or sleepy, or it could make you feel so bad that you are drowsy or sleepy enough to have a fall, lose your independence. But it can be a number of different problems. But if you take 8 medications, there's a 100% chance. And medications means prescriptions, non-prescriptions, wow, over-the-counter, supplements, herbs, all of those things are things that influence each other, the medications.
And the average senior is taking 8 medications, and with 8 medications comes a 100% chance of having a medical-related problem.
Correct.
Wow. That's
an eye-opener.
Yes. It's definitely striking.
That usually, when I mention that, in the speaking engagements that I go to, there is usually a gasp in the crowd.
Wow. Now, you talked a little bit earlier. Obviously, you're changing some things that the patients are doing, having the involvement of the physician. Are physicians typically receptive to what you're doing?
Physicians like to have information that's going to help their patients have a better response. Because there are not many pharmacists who do this to the extent that I do. It's sometimes a learning curve to let them know where I'm coming from. But all physicians who are interested in the best outcomes of their patients, who are willing to look at a different perspective, they're receptive to at least considering or being aware of the potential that some of the medications that are being prescribed may be a problem. Now, the medications they're prescribing may be perfectly correct, but it may be the medications from another prescriber that's causing the problems. But that's the whole problem that we have today, because there's so many different physicians. The medications don't stay in one spot. Your heart medications goes all over your body, creates problems all over your body, or has the potential to. So it's trying to keep all physicians aware of what's happening with the patient, and that's part of the big challenge is the tweaking of the medicine and adjusting the medicine that's going to get the patient where you need to. It's actually the interaction of working with a lot of different physicians.
Wow. So one physician oftentimes is not going to be in a position to manage the use of multiple medications. They may not be aware. And pharmacies may not be in a position to as well, because many seniors frequent more than one pharmacy as well.
Actually, seniors can see anywhere 6 to 7 different pharmacies. They can have their primary pharmacy. They can have a mail order or a VA pharmacy. They can see a specialty pharmacy. Many seniors will go to the pharmacies and get their regular medicines and go to another pharmacy for their $4 prescriptions or another pharmacy for their antibiotics. They can go to a compounding pharmacy for something else. I had one patient who was using 6 different pharmacies.
Wow.
Nobody had a clear record of what this patient was on. I looked at the list that he was taking to the doctor. None of his doctors had a list of everything this gentleman was on.
Wow. A lot of good information, Lynn. We're talking about helping seniors use their medications more wisely, improving health, and conserving resources. Lynn Harrelson, a senior care pharmacist and owner of Senior Pharmacy Solutions, is my guest in the studio. We'll pause for these messages and be back with Lynn and more topics of interest to seniors in the Louisville area. You're listening to Aging with Options on 970 WGTK.